Good morning, everyone. Today, today's topic is about artificial respiration. So, first we will see about the indications. So, the artificial respiration is indicated where the respiration fails but the heart continues to beat. So, whenever the respiration fails, we are supposed to give immediately artificial respiration. And the arrest of breathing occurs in some following conditions. First one is accidents, and the next drowning, in case of gas poisoning, in electric shock, as well as during anesthesia. So these are all the conditions where the artificial respiration is necessary. The stoppage of oxygen supply even for 5 minutes can cause irreversible changes in the tissues, particularly in the tissues of the cerebral cortex. So the artificial respiration must be started quickly without any delay before the patient go for cardiac failure. So the purpose of artificial respiration. So the two main purposes of artificial respiration, one is to aerate the alveoli, that is ventilation, improving the ventilation, that thereby it maintains the gaseous exchange. And the next is to stimulate the respiratory centers by alternate alternate inflation and deflation. So these are the main purpose of artificial respiration. So let us learn about the methods of artificial respiration. So we have two methods. One is by manual method and another one is using machines, it's mechanical methods. First, manual method. So manual method. So we are giving manually respiration. So the manual method can be applied quickly without any delay for waiting for the machines. Here the affected person must be provided with clear air. So if the victim is surrounded by overcrowded population, have to clear off the person with highly ventilated, and the clothes around the neck as well as the chest region must be loosened immediately. Next, check for the oral cavity. So the mouth, face and the throat should be cleared of if any mucus or even saliva, or else any foreign particles inside the mouth. You have to remove the foreign particles. So finally, the tongue must be drawn forward and it must be prevented from falling posteriorly, which can cause airway obstruction. So it is must to pull forward. So manual methods are of two types. The first type is mouth-to-mouth breathing and the second one is Holger-Nielsen technique. So the first mouth-to-mouth breathing is the most effective method because it directly stimulates the respiratory centers, which is located in the medulla as well as pons. So the medullary centers and the pontine centers or the respiratory centers, so that gets immediately stimulated and thereby ventilation occurs. So this is the most effective method among the two manual methods. So let us see about the mouth-to-mouth breathing technique. So the procedure: first, the subject is kept in supine position and the resuscitator means the person who gives respiration to the victim. So the resuscitator should kneels at the side of the subject. Lower jaw is pulled downwards using the thumb on the subject's mouth At the same time, using your other hand over the forehead, just lift your head, neck in extended position, slightly extended position. Thereby, this position itself opens the airway. Now, using the thumb and the index finger, close the nostrils of the subject. Now, the resuscitator should take a deep breath before exhaling into the patient, and volume of exhaled air must be around twice the amount of normal tidal volume. So this twice the amount may easily expand the lungs of the subject. So immediately the resuscitator can remove his mouth from the subject, thereby passive expiration occurs in the subject. This may cause because of the recoiling property of the lung. So you can see in this picture, so this procedure is repeated at a rate of about 12 to 14 times per minute till the normal respiration is restored in the subject. And the mouth-to-mouth method is the most effective method, manual method, because the resuscitator is exhaling more and more amount of carbon dioxide, so that chemical reactions occurs. So the carbon dioxide, more amount of carbon dioxide in the blood mixes with the water and forms the carbonic acid, which is unstable. Again, it dissociates into bicarbonate and the hydrogen ion concentration. So the increase in the carbon dioxide level in the blood increases the amount of hydrogen ion concentration. So this hydrogen ion concentration is highly sensitive to the chemoreceptors. So the chemoreceptors get stimulated by the increase in the hydrogen ion concentration, which is produced by the carbon dioxide, increase in the amount of carbon dioxide. So this chemoreceptor sends efferent impulses to the respiratory centers. So the respiratory centers, as I told you before, it is located in the medulla as well as the pons in the brainstem. So this in turn causes hyperventilation, thereby normal restoration can occur. So this is the most effective manual method. And the next second one is Holger-Nielsen technique. This is also known as back pressure arm lift method. So back pressure, you are giving pressure at the upper back region, at the same time lifting the arm, that will expand the thoracic region, so inspiration occurs. So this technique, Holger-Nielsen technique, is also known as back pressure arm lift method. Subject is, so let us see about the procedure. First, the subject is kept in prone position with head turned to one side. Now the hands are placed under the cheeks with elbow flexed as well as shoulder in abducted position. Resuscitator kneels down in front of the subject, facing towards the head. Then he places the palm of the hands over the back of the subject and bends forward with straight arm. So now the subject is kept in prone position with the hands, shoulders abducted, elbow is flexed position, and now the cheeks is placed over the hands so that the head is turned to one side. Now the resuscitator has to kneel in front of the patient so that he can able to face the victim's head. Then he places the palm of the hands over the back of the subject. At the same time, he has bent forward with a straight arm. The whole body weight must be put on over the hands to the back of the subject. So the weight of the resuscitator as well as the pressure on the back of the subject causes compression of the chest and expel it from the lungs. Later, the resuscitator leans back. At the same time, he draws the subject's arm forward by holding it just above the elbow. So this procedure immediately automatically causes expansion of the thoracic cage. Thereby, this gives space for the lungs to expand. So this expansion of the thoracic cage may cause entry of air from the atmosphere into the victim's lungs. So that is explained in this picture. So the movements are repeated at a rate of 12 times per minute till the normal respiration is restored. So these are the two methods. One is mouth-to-mouth breathing and the other one is Holger-Nielsen technique. So among the two, mouth-to-mouth breathing is the most effective method. So next we will see about the mechanical methods. So the mechanical methods of artificial respiration becomes necessary when the subject needs artificial respiration for a long period. So this is essential during the respiratory failure due to paralysis of respiratory muscles or any other cause. Mechanical methods are of two types. One is drinker method and another one is ventilation method. So the drinker method machine used in this method is called iron lung chamber or the tank respirator. The equipment has an airtight chamber made up of iron or steel. Procedure: the subject is placed inside this chamber with the head outside the chamber. By means of pump, the pressure inside the chamber is made positive and negative alternatively. During the negative pressure in the chamber, the subject's thoracic cage expands, thereby inspiration occurs. But during the positive pressure, the expiration occurs. Thereby, the alternate change in the pressure inside the chamber can cause inspiration and expiration alternatively. So this is shown in the picture. So the subject's head is placed outside the chamber. So through the pumps, motor pumps, the pressure inside the chambers is made negative as well as positive alternatively. Thereby inspiration and expiration occurs. So by using this method, that is tank respirator method, the patient can survive for a long time, even for a period of 1 year, till the natural respiratory functions are restored. So the last one is ventilation method. A rubber tube is introduced into the trachea of the patient through the mouth. By using the pump, the air is pumped into the lungs with pressure intermittently. So if the patient needs ventilation for a long time, other than the manual methods, you can go with ventilation method. So in this technique, a rubber tube, that is endotracheal tube, is inserted through the mouth into the trachea. So using the pump, air is pumped into the lungs with intermittent pressure. When air is pumped, the inflation of the lungs occurs. But when it is stopped, expiration occurs. So this cycle is repeated. Apparatus used for the ventilation is called ventilator, and it is mostly used to treat acute respiratory failure. Ventilator is of two types: volume ventilator and pressure ventilator. volume ventilator. By volume ventilator, a constant volume of air is pumped into the lungs of the patients intermittently with minimum pressure. But in case of pressure ventilator, air is pumped into the lungs with constant high pressure. So that's all about the artificial respiration. So the next topic, effects of exercise on respiratory system. So let us see about the introduction. So during muscular exercise, there is a lot of changes happening on various systems of the body. So these changes may depend upon the severity of exercise, by either doing mild exercise, moderate exercise, or else severe exercise. So the changes may vary according to the severity of exercise. So the first effect is effects on pulmonary ventilation. So the pulmonary ventilation is nothing but for 1 minute how much amount of air is taken in and out. So the definition for pulmonary ventilation is the amount of air that enters and leaves the lungs in 1 minute. And it is a product of tidal volume into respiratory rate. It is about 6 liters per minute. So the normal tidal volume is about 500 ml. But the respiratory rate, if you take it as 12 per minute, the normal pulmonary ventilation is 6 liters per minute. So during exercise, this may increase. So because of hyperventilation, increase in the ventilation because of more and more demand for oxygen, hyperventilation occurs. So this may cause increase in the rate and force of respiration. In moderate exercise, respiratory rate increases to about 30 per minute and tidal volume increases to about 2000 ml. Thus, the pulmonary ventilation can increase to about 60 liters per minute during moderate exercise. So just for even moderate exercise, the pulmonary ventilation increases to about 10 times more than the normal, that is 60 liters per minute. So, but in case of severe muscular exercise, so during strenuous exercise, this may further vary, increase up to 100 liters per minute. So let us have a look about the factors that increases the pulmonary ventilation during exercise. Higher centers, chemoreceptors, proprioceptors, body temperature, acidosis. So the higher centers, the rate and depth of respiration increases during the onset of exercise. Sometimes before starting the exercise itself, just by thinking about or else thought of this exercise itself increases the rate as well as force of respiration. So this phenomenon is something psychic phenomenon, and that is due to the activation of higher centers like the sylvian cortex and the motor cortex of brain. Higher centers in turn accelerate the respiratory process by stimulating the respiratory centers. So the second factor is chemoreceptors. Chemoreceptors which are stimulated by exercise-induced hypoxia and hypercapnia. So hypoxia is nothing but decrease in oxygen, but hypercapnia is increased carbon dioxide. So this hypercapnia, hypoxia, this may easily stimulates the chemoreceptors. So the chemoreceptors are very sensitive to the hydrogen ion concentration. So that may increase because of the hypercapnia, that is increase in the carbon dioxide, as I explained in the above video. So these receptors sends impulses to the respiratory centers, which in turn increases the rate and force of respiration. So thereby pulmonary ventilation increases. And the third factor that increases the pulmonary ventilation is proprioceptors. Proprioceptors are present throughout the muscles, joints, ligaments, etc. So this gets activated during exercise, which in turn sends impulses to the cerebral cortex through the somatic afferent nerves. Cerebral cortex in turn causes hyperventilation by sending impulses to the medullary respiratory centers. Now the body temperature, which increases by muscular activity, it can also increases the ventilation by stimulating the respiratory centers. And the last factor is acidosis. Acidosis developed during exercise also stimulates the respiratory centers, which in turn results in the hyperventilation. So thereby the pulmonary ventilation gets increased. So the main factors like higher centers, chemoreceptors, proprioceptors, even the rise in body temperature, development of acidosis, all these may increase the pulmonary ventilation during exercise. So the second effects on diffusing capacity for oxygen. So the diffusing capacity for oxygen is about 21 ml per minute at rest, but it can increases from 45 to 50 ml per minute during moderate exercise because of increased blood flow through the pulmonary capillaries. Effects on consumption of oxygen. Oxygen consumed by the tissues, particularly the skeletal muscles, is greatly enhanced during exercise. Because of vasodilatation in muscles during exercise, more amount of blood flow through the muscles and more amount of oxygen diffuses into the muscles from the blood. The amount of oxygen utilized by the muscles is directly proportional to the amount of oxygen available. So the next effects on oxygen depth. So the oxygen depth is nothing but the extra amount of air required by the muscles during recovery from severe muscular exercise. After a period of severe muscular exercise, the amount of oxygen consumed is greatly increased. So the oxygen depth is about 6 times more than the amount of oxygen consumed under rest. So the oxygen depth is nothing but the extra amount of air which is required by the muscles during recovery from severe muscular exercise. So during this, after a period of this severe exercise, the amount of oxygen consumed is greatly increased. VO2 max. So the VO2 max is volume of oxygen, maximum volume of oxygen consumption. So the definition for VO2 max is the amount of oxygen consumed under maximal aerobic metabolism. So this is a product of maximal cardiac output and maximal amount of oxygen consumed by the muscle. In healthy males, the VO2 max is 35 to 40 ml per kg body weight per minute, but in females it is 30 to 35 ml per kg body weight per minute. But during exercise, this VO2 max increases by about 50%. The last one is effect on respiratory quotient. Respiratory quotient is the ratio of carbon dioxide production to the oxygen consumption. So during rest, the respiratory quotient is about 1.0, but during exercise it increases to 1.5 to 2. However, at the end of exercise, the respiratory quotient reduces to 0.5. So that is, these are the effects. First one, effects on pulmonary ventilation and effects on diffusing capacity for oxygen, effect on consumption of oxygen, effects on oxygen depth, effects on VO2 max, and finally effects on respiratory quotient. So the defense mechanism of the respiratory system. In the respiratory system, lungs plays an important role in the defense mechanism. So the defense functions of the lungs are performed by their own defenses. So it is by the presence of various types of cells in the mucous membrane which lines the alveoli of the lungs. So the defense mechanism of the lungs itself inside the mucous membrane which lines inside the alveolar cells, alveoli. The types of cells are leukocytes, macrophages, mast cells, natural killer cells, and the dendritic cells. So let us have a look about all these cells, how it acts as a defense mechanism. So the first, lungs' own defenses. So the airway tract, that's air passage, which is lined by the epithelial cells, secretes some innate immune factors, defensin and cathelicidin. So these substances are the antimicrobial peptides which play an important role in lungs' natural defenses. Defenses are nothing but the antimicrobial peptides. So there are two types of defensin. One is alpha defensin, another one is beta defensin. So the alpha defensin are secreted by neutrophils, macrophages, Paneth cells in small intestine, but beta defensin is secreted by airway epithelial cells, which is in the respiratory tract, as well as salivary glands and cutaneous cells. Cathelicidins are also the antimicrobial peptides, so which plays an important role in wide range of antimicrobial activity in air passage and lungs. Defense through leukocytes. The leukocytes, particularly the neutrophils and lymphocytes present in the alveoli of lungs, provides defense mechanism against the bacteria and virus. So the neutrophils kills the bacteria by phagocytosis. Phagocytosis is nothing but the cells that engulf the foreign particles. So the lymphocytes develop immunity against bacteria. Defense through macrophages. The macrophages engulf the foreign particles and the pathogens which enter the alveoli, and thereby it acts as a scavenger in lungs. Macrophages are also involved in the development of immunity by functioning as antigen presenting cells. When foreign organisms invade the body, macrophages and other antigen presenting cells kills them. Macrophages secrete interleukins, tumor necrosis factor, and chemokines. Interleukins and tumor necrosis factor, which activates the general immune system of the body. Chemokines attract the white blood cells towards the site of any inflammation. Thereby, it helps in defense mechanism. And the fourth one is defense through the mast cells. So the mast cells is a large cell which resembles the basophil. These mast cells produces the hypersensitivity reactions like allergy and anaphylaxis. So this also secretes heparin, histamine, serotonin, and hydrolytic enzymes. And the next is defense through natural killer cell. Natural killer cell is a large granular cell considered as the third type of lymphocyte. So usually the cells are present in the lungs and other lymphoid organs. Its granules contains hydrolytic enzymes which destroys the microorganisms. And this natural killer cell is said to be the first line of defense in specific immunity, particularly against viruses. The functions of natural killer cell. So the natural killer cell's main function is to destroy the viruses, destroys the viral affected or damaged cells which might form the tumors, destroys the malignant cells and prevents development of cancerous tumors. It secretes cytokines such as interleukin 2, interferons, colony stimulating factor, and tissue necrosis factor alpha. So the last one is defense through dendritic cells. Dendritic cells in the lungs also plays an important role in immunity. Along with the macrophages, these cells also function as antigen presenting cells. So that's all about the defense mechanism. Thank you.